Thank you very much. Thank you, Chairman Miata, for having me here today, and also Dr. Walker as well, too, for, again, another excellent conference. And I look forward to seeing you guys next year as well. So I'm going to be talking a little bit about CROSSWALK and also CrossLead Pro 018, 014. Just kind of a brief overview. Obviously, we have a lot of choices when it comes to microcatheters as well, too. But a lot of them are very basic in design. And one thing Asahi has done is really put a lot of engineering into the design of their products. And one of the failures of a lot of these hypo tubes is that they kink, they don't torque, they don't give you wire control. And by placing a braid within the CROSSWALK catheter, it really allows for both torque control and pushability with a very hydrophilic catheter as well too that tracks very well too, and I'll hopefully be able to show that to you as well. And there's also these radiopic markers that you guys can track as well too, which is highly visible under X-ray as well. Nice thing too is also comes in a variety of angles as well too. For you, some folks prefer a greater angle than others, but there's a number of varieties here as well too. And the telescoping technique is quite useful as well, where you can use larger catheters and smaller catheters to potentially reach further down. This is really useful, especially if you're coming for a radial peripheral approach. Also, the other thing to know is that the 014 and 018 varieties are compatible with the 2.9 French Cook pedal sheath. So if you want to really stay small, this is a really nice option as well too, without placing a full-size sheath in a patient, especially with small tibial vessels. So this is a size matrix, so recognize that there's a 170 centimeter long catheter now for that radial peripheral option as well. And so this is what it looks like too with that so-called telescoping technique and the different catheter combinations. So this is an example here too, very straightforward case, high-grade AT occlusion CTO, and you can see here I'm actually taking the CrossLead 018 wire down very easily through this occlusion, and this is actually taking the CROSSWALK all the way down too. So you can see that. I like to do this. This is probably off-label, but many times I'll take these catheters. I'll know if they're actually good or not if I can take them without a wire. And this thing tracks beautifully too. It's actually one of my CTO crossing techniques. Afterwards, place a balloon, ended up with a very nice result, and you can see excellent runoff to the foot afterwards. So let's talk a little bit about CrossLead Pro 018 and 014 as well too. You heard Dr. Sastry talk about this very briefly as well too. But the design here of the CrossLead wires is really one to create some uniformity to the Asahi portfolio. Asahi has been known to make a great number of amazing wires, but it was actually very complicated because you had a lot of wires, and if you talk to every operator, they all had their preferred wires that they use. But sometimes the reason why that occurred is because either out of habit or maybe they saw somebody use a particular wire. And the idea was to bring some uniformity to the approach of peripheral intervention. And so the idea is that you can coalesce this entire large portfolio of wires down to some 4 basic wire types that we could use for consistent intervention. So CrossLead Pro 018 and 014 both have a significant tip durability, so you're not going to bung up the tip of the wire as you might see in some of the other competitor products out there as well. So you have the shapeable tip, it comes with a shaping tool, you have really good torque force and control. The back end is highly supportive, so some folks like to use other competitor wires because you can deliver your equipment, but this wire is designed to really deliver heavy-duty equipment, large bore equipment as well too, with excellent support and also pushability as well too. So we saw that graph with the back end support as well. And so this is that hybrid core, it's both nitinol and also stainless steel core. It uses that Act 1 technology, which allows for that one-to-one torque transfer. This is seen across the line, and also with a very nice hydrophilic coating on there as well too for excellent crossing purposes. We saw this before as well too, the differences in their tips as well too. So Gladius Mongo 18 was my preferred 018 wire. I also used some Command 18, and I've pretty much completely switched over to CrossLead Pro 18 at this point too, because I really think it is a superior wire. You can see the difference also too in the tip, because you can reuse this wire multiple times from multiple access points without worrying about that as well too. And that's that durability you can see too as well, compared to something like the Command 18, which was one of my other competitive wires that I used before. 014, similar technology as well too. Same type of design, again, with that Act 1 technology as well too. And you can see here, I use a lot of Mongo ES, but also Gladius as well too. And you can see what happens with the tip of the Gladius in comparison to the CrossLead Pro. So this is really important because you end up spending a lot of money on extra wires. Using this platform allows you to save on costs and also have more predictability in terms of how your wire is going to perform. Command 14 is also something I use quite a bit of as well too, but again, you see that deformation of the tip as well too. You don't see that as much with CROSSLEAD Pro. And also the knuckling is really important as well too. That narrow loop really prevents those large dissections and more consistent crossing through CTOs. You can see the difference between regular Mongo versus the regular Gladius 014. CROSSLEAD Pro gives you that really predictable narrow loop, which is really useful. And this is an example here too, the difference between CROSSLEAD Pro 14 versus say Command 14. Again, something that I use quite a bit of, but you can see right away the CROSSLEAD will form that predictable small knuckle, narrow knuckle, in comparison to say Command, where it might grab a piece of plaque, and then next thing you know, you have this massive loop, and then you're outside the vessel and you've created a huge dissection plane. So I'm going to show you a case here too. This is a multi-modality wire crossing case. I'm in the hospital, so I use a lot of equipment, but that may be good for industry, but it's not necessarily good for the hospital and also the cost of the case. So this is a 56-year-old woman, diabetes, hypertension, dyslipidemia, former smoker. She presented with a hallux wound as well too, Rutherford 5. So she's got gangrene of the tip of the toe along with associated osteomyelitis. And this is the initial picture that you see here too. Really, we don't have much going on here. So you see total occlusion of the AT and essentially the whole, all of the tibial vessels. There's really nothing going down to the foot. And on ultrasound, really couldn't find anything that was obvious. Everything was occluded. So I first tried coming from above as well too, and I'm using again the CROSSLEAD 018 initially, and you can see I'm kind of poking here with my microcatheter, and I'm taking that predictable narrow loop that you see going all the way down. I take my microcatheter down to the foot, again probing as well too. I just wasn't really happy where I was going here as well too. So I went ahead and then under ultrasound accessed the occluded posterior tibial, really kind of just right at the common plantar level. And this you can see here too. Again, I like to do this a lot with the 018 CROSSLEAD because I can take either a dilator or take again that 2.9 French sheath and use it to deliver microcatheters. In this particular case, I did use a 4.5 slender over the 018 CROSSLEAD to then deliver my balloon. So you can see here I'm going up with that loop, and then here this is penetration. So I switched out from 018 CROSSLEAD because I couldn't get through with the loop, and I used penetration to get back into the true lumen, into the popliteal artery. Here I'm ballooning afterwards too. You can see I have a microcatheter from above and my balloon from below. This is a long 018 balloon. And then now I'm switching to 014 CROSSLEAD from above, going through the new lumen that I created through the TP trunk into the posterior tibial artery. And then you can see my axis around the foot there. I put my finger on there too, radiating my hands. And afterwards too, you can see we've got that predictable loop now going through the plantar pedal loop very easily through that channel that kind of had created before from above through the AT. Here we're ballooning now as well too. This is the beauty. The 014 CROSSLEAD provides excellent support. So I'm able to take now from above a 018 balloon actually. This is I used an R2P 018 balloon to go ahead and balloon the plantar pedal loop. And then you can see this here too on this next picture. So here's that the R2P balloon getting pushed all the way down. And then you can see I've got my CROSSLEAD wire all through the loop, all the way back up into the AT. And so you can see I'm actually tracking that balloon all the way up there as well too. So ended up with really nice results here as well too. So from above you can see my AT and PT as well. And you can see the proof is in the pudding down in the foot. You can see a nice wound blush down the toe when we had nothing before. So this patient really had a so-called desert foot. And then now she's actually, when they went to do her amputation, they had blood squirting out. So in summary, so CROSSWALK facilitates wire lesion crossing. You have that, especially the telescoping technique, even with RTP options, compatible again with 2.9 French for the 018 and 014 varieties. It's braided for that support and control. CROSSLEAD Pro, we have 035, 018, and 014 options now too. It really simplifies your wire choices. We don't have to choose 20 different wires. We've got this one class of wires which will handle 90% of the work that you need to do in terms of providing support, crossing, reusability as well too. And then when you got really tough lesions you need to cross, we've got penetration, which is that 60 gram tip load for doing cap crossing, cap penetration, and also dense lesion crossing. And then tracker wire, which we really didn't talk enough about as well too, which is really an excellent wire for when you want to get through tortuosity through small vessels, if you want to go through arcuate branches, essentially reconstruct the pedal arches. This is a perfect wire. So we would go through 20 fielder wires, or you can have one tracker wire, and then use that wire again too. And actually it provides fairly excellent support as well too, even for your balloons as well. It's predictable, it's reusable, it's going to save on cost. And again, the idea with these 4 wires is essentially we can now, really 5 wires, is that we can simplify your overall cases. Thank you so much.
Thank you, Jay.